Welcome. Today we're discussing bananas, a fruit that offers specific benefits for gout management through their impressive potassium content and practical advantages that make them an excellent dietary staple. Let's start with potassium, because that's the star of this story. Bananas are renowned for their potassium content, providing about 400 to 450 milligrams per medium banana. That's roughly 10% of your daily requirement in one convenient package. For gout patients, potassium is particularly important. Here's the mechanism. Potassium supports kidney function and proper fluid balance in your body. Your kidneys are responsible for filtering and eliminating uric acid. When your kidneys function optimally, they clear uric acid more efficiently. Potassium helps maintain the electrochemical gradients that drive kidney filtration. It's not a direct uric acid reducer, but it creates the conditions for better uric acid elimination. Additionally, adequate potassium intake may help reduce the risk of kidney stones, which are more common in people with gout. Uric acid crystals can form stones in the kidneys, not just in the joints. Supporting kidney health through proper potassium intake is a form of dual protection. Bananas are low in purines. That's essential. You're getting concentrated nutrition without any uric acid burden. The protein content is minimal, the purine content is negligible, and the nutrient density is high. That's an ideal combination. Let's talk about energy. Bananas provide natural, easily digestible carbohydrates. For people with gout who may need to limit certain protein sources and carefully manage their diet, having reliable energy sources that won't trigger problems is valuable. Bananas deliver that energy without complications. The convenience factor cannot be overstated. Bananas come in their own natural packaging. They require no preparation, no refrigeration before they're cut, no utensils to eat. You can throw one in your bag for work, keep them on your counter at home, eat them anywhere. For busy people managing a health condition, this kind of simplicity is genuinely helpful. The versatility of bananas is another practical advantage. Eat them plain as a quick snack. Slice them into oatmeal or yogurt at breakfast. Blend them into smoothies for natural sweetness and creamy texture. Even use them in baking as a healthier sweetener alternative. This flexibility makes it easy to incorporate bananas into various meals and eating patterns. Now, let's address some common concerns. Some people worry about the sugar content in bananas. Yes, bananas contain natural sugars. A medium banana has about 14 grams of sugar. But here's the important context. That sugar comes packaged with fiber, vitamins, minerals, and in a whole food form that your body processes differently than refined sugar. The glycemic index of bananas is moderate, meaning they don't cause rapid blood sugar spikes. The fiber content, while not as high as some fruits, still moderates sugar absorption. For most people with gout, eating 1 or 2 bananas per day is perfectly fine and won't negatively impact uric acid levels. There's also a myth that bananas are somehow fattening. They're not. A medium banana has about 105 calories. That's similar to an apple or orange. If bananas fit into your overall calorie needs, they're not going to cause weight gain. In fact, their fiber content and natural sweetness can help satisfy cravings and prevent overeating of less healthy foods. Ripeness matters somewhat for both nutrition and digestibility. Less ripe, slightly green bananas have more resistant starch, which acts like fiber and may be beneficial for blood sugar control. Very ripe bananas with brown spots have more simple sugars, but are easier to digest. Choose based on your preference and how your body responds. One caution: if you have kidney disease, as opposed to just gout, you may need to monitor potassium intake more carefully. High potassium can be problematic for people with significantly impaired kidney function. If you have chronic kidney disease, discuss appropriate potassium intake with your healthcare provider. But for most people with gout and healthy kidney function, the potassium in bananas is beneficial, not concerning. Let me share a practical application strategy. Consider making bananas your default portable snack. Instead of reaching for processed snacks that might contain ingredients problematic for gout, keep bananas readily available. They satisfy hunger, provide steady energy, support your kidneys, and keep you on track with your dietary goals. Bananas also work excellently in post-workout recovery, if you're physically active. The carbohydrates replenish energy, the potassium helps with muscle function and reduces cramping, and the overall nutritional profile supports recovery without gout-triggering ingredients. In terms of sustainability and economics, bananas are generally affordable and available year-round. They're one of the most accessible fruits globally, which makes them a practical choice regardless of where you live or your budget constraints. In conclusion, bananas are an excellent food for gout management. They provide kidney-supporting potassium, natural energy without purine load, and unmatched convenience. They're safe, effective, and practical. Make bananas a regular part of your routine, and you're supporting your body's ability to manage uric acid effectively while enjoying a naturally delicious food. Simple, effective, and proven. That's what bananas bring to your gout management strategy. Thanks for listening.